This program was sponsored by Perfect Touch Home Care Firm. At Perfect Touch, it's all about you.
Hello and good afternoon. This is Aarti Gupta, your hostess for Golden V. That is the name of our show. V means in French, life. So, Golden Life. We are going to be discussing about health and wellness and bringing in all different variety of guests to my show. Our special guest today has came all the way from New York City. He is the Chief Medical Officer of Sentosa Care LLC in Woodmere, New York. So, without further ado, let us please introduce Dr. Myles Gombert.
Thank
you
so
for
much.
coming in, Dr. Gombert.
I'm happy to be here.
I read about your bio, and I wanted to know what made you get into the career of becoming a doctor.
Well, I guess it was my parents who influenced me largely when I was in school. And I graduated medical school in the early 1970s, and largely the early part of my career was spent in academic medicine at Downstate in Brooklyn. I'm an internist, I'm an infectious disease practitioner, and have achieved a variety of academic ranks in medical schools. I was the medical director at Downstate for a number of years and also the senior associate dean for the College of Medicine. Ultimately, I went to the North Shore LIJ Health System, now it's called Northwell, as chairman of medicine at one of their hospitals in New York City. I reinvented myself several years ago in the long-term care universe, and it has been a remarkable transformation and one of the most rewarding professional activities I've ever done.
So can you tell us, I know every day is a very different, you have different things that you have to take care of and tasks, but could you describe us what a typical day it is like when you go to the hospital?
Well, I don't go to the hospital anymore. I confine my activities to the long-term care universe, rehabilitation facilities or post-acute care facilities and long-term care facilities. While you gave me the introduction for working for Sentosa Care is related to other long-term care organizations. The relationships are varied. It's a multi-state enterprise, but there's another organization called Millennia Care, of which I'm the chief medical officer as well, which is the glue that binds all these organizations together. I have the privilege of working with some very, very talented people, other doctors, administrators, nurse practitioners, nurses, and we provide a variety of services to this entire network of long-term care and post-acute care facilities that serves to educate, influence, bring evidence to the table, and promote both value care, which includes the improvement of the quality of care, along with an eye towards cost efficiencies, and specifically trying to make the patient-provider experience better.
So can you elaborate a little more about what is enlisted in the quality care? For instance, if I come in as a patient, as a new patient, what is the procedure or steps you will need for,
Yes.
You need to implement that?
Well, the long-term care industry is undergoing a transformation. The market forces are in place. The baby boomers are aging into that population, hopefully slowly. And it's a necessary part of our society to improve the care for our seniors. We educate, we scan the literature, we go to conferences, we talk to consultants, and we try and distribute information throughout all of our facilities that will help our seniors during the latter years of their lives. Mm-hmm. We do so through a variety of meetings, leadership presentations, monthly medical staff meetings, and we try and perfect the communication amongst all of our organizations to enjoy the economies of scale, the ability to identify best practices, and sharing what we've learned amongst all the stakeholders in our system. We have moved the dial. It is a slow and grinding process, but we are moving forward and making progress.
So can you tell us what is the most rewarding part of your job?
Well, I have two components of what I do. One is the clinical component, and the other is more of the administrative and managerial component. As I said to you a moment ago, the most rewarding part of my clinical professional career is being able to provide care to our senior population. Mm-hmm. The ability to inform, to educate, to empower our seniors and their families, bringing them the best evidence, identifying where science leads, to give them the opportunity for autonomy and self-determination is very rewarding to me. Not just focusing on the disease, but to focus on the individual, mm-hmm. where they came from, what their values are, identifying goals of care. How do you want to be treated? All those things are very important for our patients and residents, and very rewarding for me professionally.
So, like I said, you being an internal medicine doctor, can you tell us what are some of the toughest problems that you had faced in your career?
Some of the challenges we face now in long-term care, which we like to think of as opportunities as well, are current challenges and contextual challenges. The current challenges we're facing right now is influenza. Influenza is gripping the nation, and certainly the New York metropolitan area. We do our best to prepare. So the first step in influenza prevention is preparation. We educate, we vaccinate, we screen. When we identify, we institute infection control practices. Mm-hmm. We treat, we cohort, and to the extent possible, try and maintain patients in our facilities. Contextually, in long-term care, we want to make sure that we bring appropriate evidence to all the providers. Make sure that we are current with the science and the body of knowledge out there that pertains to this population of patients.
Mm-hmm. We are in conversation with Dr. Myles Gombert. We're actually going to be having a short commercial break, so stay tuned.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Welcome back to Golden V. This is your host, Arti Gupta, and our special guest today is Dr. Myles Gombert, who came from Whitmere, New York. Again, thank you for joining us, Dr. Gombert, to my show. And before we had gone to break, you had described the clinical as well as the administrative components of your job, which is very rewarding for you. So I wanted to shed more light onto what is a well visit. If somebody, like I said, a new patient comes in to you, could you describe the aspects of what a well visit is, how you should be prepared, and all that?
Yes, I can. The patients come to the nursing home from only a few different venues. Most of the time they come to the nursing home from the hospital after being in the hospital for an acute care stay, and they come to the facility for a rehabilitation. Some individuals come from the community because they are no longer able to take care of themselves, or their needs exceed the capacity to either have that care or to obtain that care. Most of our patients come from the hospital, though, after an acute illness. Mm-hmm. When a patient comes into the facility, they're assigned to a physician, usually on the basis of geography. A physician covers one floor or another, and so there is no real choice. Most of the facilities have a panel of doctors who work there. Largely, the patient who has a physician on the outside in an office is going to see a different physician in the hospital, a hospitalist, mm-hmm. and will see also a different physician in the nursing home. So there is an admission procedure where the resident is examined and interviewed, their medical records are reviewed, and interventions are put into place. Patients don't really have to prepare in any particular way for a well visit. Mm-hmm. They are already dependent upon others, and the physician and the patient typically meet in the patient's treatment room or bedroom, and the examination and interview takes place there.
So are the families also involved of the patient also as well?
Yeah, curiously, in the hospital, which is very fast-paced, where lengths of stay are kept low, the long-term care facility and the post-acute care facility has greater opportunity for family, resident, and provider interaction. Mm-hmm. And what we try and do is incorporate all of those elements into the care plan. Frequently, when we take care of seniors, they're not able to necessarily express themselves as well as they had in years past, and they need an advocate. And they need their family members there to help explain their current situation, maybe even to inform us of their goals of care. So we try and take a look at these residents in a very comprehensive approach, and a very contextual approach, so that we're able to provide the best quality of life for the patient. And quality of life is a very important issue. We're not just looking for longevity, but trying to combine a lifetime with the quality of that patient's existence. Mm-hmm.
This sounds very interesting because, like I said, the seniors, I should say the baby boomers community, like you were saying, it's very important specifically for that group of people because, I mean, what I'm trying to point out is the better care you get, and you said the quality of care for that specific patient gets, like I said, it's very rewarding for the patient if they can find a doctor or a medical professional who can take care of their needs, the patient's needs.
Post-acute care and nursing home care is very, very difficult.
Okay.
It's very difficult. Hospital is very fast-paced. People are in and out in 3 to 5 days. In the nursing home, people come in and they are there for weeks, if not months. And those who can no longer receive the care necessary at home or in a less organizational perspective will stay and live in a nursing home. So there's a lot of longitudinal work to be done with individuals. The hospital is a cure model. The nursing home is a care model. And if we look monolithically at disease, that's often done in the hospital, trying to cure a disease. In a nursing home, there's more opportunity to really identify where that disease really exists in the patient's overall context. We get an opportunity to reassess some of those contexts, and diseases that existed and played a large role in an individual's life 10 years ago may not be as dominant 10 years later. It's complex. One of the challenges we have, particularly dealing with this very vulnerable population of patients, is to match up patient and family expectations with reality. Tragically and unfortunately, many of our seniors that we treat go back and forth from home to the hospital to the rehab facility, back and forth to home to hospital to rehab facility. And we want to make sure that our care is aligned with their expectations. We want to make sure that families are informed that the treatments that benefited your loved ones in the past and are no longer providing that same benefit in the present, now we have to have a more challenging conversation. How is it you wish to be treated? How is it you wish to have comfort provided to you? How do we maintain your dignity? And as we all age in our lives, these are the things that we want. We want comfort, we want dignity, we want attention to be paid to us.
Dr. Gombert has very enlightening myself and also our viewers as well. So you just stay right where you are, and we're going to be back after a quick commercial break. Stay tuned.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
Welcome back to Golden V. And our special guest today is Dr. Myles Gombert, who is the Chief Medical Officer of Sentosa Care LLC in Woodmere, New York. Dr. Gombert, can you elaborate a little bit more about how a senior patient, because there are so many doctors out there and so many different networks. So could you tell us, like, what are the requirements of how a patient can choose a doctor for themselves?
It's a complicated question, and I'll give you some of my insight, but I urge you and your listeners to use our conversation here as a springboard to gather further information. There are many sources that you could tap into to identify a physician, and they're the usual things. I read in the AARP bulletin just a couple of months ago an unusual twist, and I want to talk about medication use. We in our society go from provider to provider, and medications are added and added and added. And one of the things that the AARP bulletin pointed out is that when you interview a doctor, look to see if your doctor, as a senior, is able to reassess all the medications that have been given to you over your lifetime. And curiously, we have been used to prescribing in our society They say, look for a doctor who's able to de-prescribe. The term de-prescribing has crept into our lexicon more recently and is just a curious twist on how to identify a provider that may provide great benefit to you.
My next question I wanted to ask you was, can you tell us a bit about the models of healthcare? I mean, there are so many different types, but if you can just specifically, I should say, maybe 2 or 3 models that you are familiar with.
Well, again, healthcare is undergoing a transformation. Just several years ago, if you went to your doctor in an office and had the misfortune of going to the hospital for an illness, that doctor would typically pay visits to you, make rounds on you, and be the provider in the hospital. Today, there's been a sea change in the model of care, where most patients who are hospitalized are cared for by a hospitalist. In the nursing home, the general model of care is being provided by, excuse me, by a physician who is typically an independent contractor with an office on the outside coming into the nursing home to provide care. Models of care are emerging where nurse practitioners and physician extenders are primarily responsible for the care of that resident. Just this morning, I'm watching television and I see that on one of the telecommunication companies, without giving them a plug, is using distance medicine through the internet and computers. Telemedicine is becoming another emerging model of care. I suspect eventually in the long-term care facility, as hospitalists have dominated the model of care in hospitals, that specialists in nursing home care will be dominating the model of care in the nursing home as well.
So can you, specifically for our senior viewers, can you tell us about what are your, I should say, your perspective or point of view of the end of life care?
Unfortunately and tragically, nobody gets out of this alive. And end of life will confront everybody. And it is a difficult and an emotionally wrenching point in time for patients and their families. I think society expects us in the nursing home, which can be for many their last address, to be expert and professional in providing that type of care. And when patients are at or near the end of life, it is time for us in our part of the industry to manage that period of time professionally, expertly, with compassion, and to do it well. It is not a time to necessarily send that individual to another caregiver. The New York Times did a survey a few years ago asking their readers, how do you want to die? 92% said they want to die peacefully, without pain, in their home, surrounded by their loved ones. We in the nursing home are their family. We in the nursing home are their loved ones. And when it comes time to holding their hand at the end of their lives, why would we want to give up that hand to somebody else? And what we're trying to do through millennia, me and my colleagues are trying to educate our providers, our nurses, our administrators, in becoming expert in providing end-of-life care and maintaining our contact with patients and recognizing that they are our family as well.
We've learned a lot, so much from Dr. Gombert in such a short period of time. And we could discuss this days and days and months about this. But there is always going to be a next time. So if you are going to be need to reach Dr. Gombert, he is in Woodmere, New York. The name of the website is www.sentosacarellc.com. If you would like to reach him and you have any questions regarding about your health and your insurance and how to get reimbursed for your health coverage. So he is the guy you need to contact. Again, it's Dr. Myles Gombert. And do you have a telephone number or an email that people can reach you if they have any questions to ask?
The website will give most people all the information they need.
Okay. Thank you so much and have a wonderful day. This is Aarti Gupta signing off from Golden V. Bye-bye.
This program was sponsored by Perfect Touch Home Care Firm. At Perfect Touch, it's all about you.